Welcome to the Neuroveda podcast for complex health. We feature expert guests who dive into ancient and cutting edge understandings of health and disease. These conversations are about food, lifestyle, and medicine just as much as about nature, culture, and politics. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine, coming to you from our clinic, Neuroveda Health, in Seattle, Washington. And we have a really fun guest today. Dr. Sascha Sajer is an experienced physician specializing in physical medicine, rehabilitation, and functional medicine, with over 30 years of expertise in clinical practice, medical consultancy, and healthcare management. After earning his medical degree from the Medical University of Vienna, Dr. Sajer completed his specialization in physical medicine and rehabilitation. He further enhanced his expertise by obtaining an MBA in health management from Middlesex University, London, and an accredited functional medicine certification, IFMCP, from the Institute for Functional Medicine in the US. Dr. Sajer is the owner and medical director of Revisalut. Did I say that correctly?
Wonderful.
Okay, perfect. Thank you. Revisalut, where he focuses on functional medicine and integrative healthcare. His previous leadership roles include serving as the medical director for the Dr. Wagner Group, overseeing 9 wellness centers and 5 rehab clinics, as well as leading the Department of Physical Medicine and Rehabilitation at the Evangelistic Hospital of Vienna. He has a very international background with a German dad, a Croatian mom, and as an attendant of the American International High School. Dr. Sajer is also passionate about sports, sailing, photography, and the arts. You're very much a Renaissance man and a very kind soul. And I'm excited for our conversation today about different types of membrane plasmapheresis. Welcome.
Thank you so much for introduction. Nice to have you and nice being on you. Thank you for the invitation.
Absolutely. Absolutely. So I'm very excited about this because, we do plasmapheresis at our clinic with the centrifugal or the centrifugal form. And I have a dear friend, Paul Malcheski, who will probably listen to this, who lives in Ohio, who has been doing plasmapheresis or apheresis since the late 60s is when he started. And so it's been really fun to have the conversations with him. We have another show with him about the development of the technology over the last 50, 60 years. And he was really clear in the beginning, which I didn't totally understand, but he was really clear about how in the US, it was the centrifugal technology that really took hold, was approved, was utilized, was created into, different devices. And then in Europe and Japan, it was the membrane filtration. And so, I've always been curious about this kind of other style that we don't yet have available, and yet is the key word here in the US. And so I'm really excited to talk about double membrane filtration plasmapheresis called Inuspheresis. And so let's just get started. What is Inuspheresis and where is it under the broader umbrella of apheresis?
Thank you, Jillian. Well, Inuspheresis is a next generation double filtration form of specialized plasmapheresis designed to semi-selectively remove harmful substances from the blood plasma. And these include immune complexes, environmental toxins such as heavy metals, pesticides, solvents, and inflammatory mediators. And the goal is to support detoxification, immune modulation, and reduction of systemic inflammatory burden. The difference to conventional plasmapheresis is that the procedure is isovolemic, it's generally very well tolerated, and highly compatible with outpatient care. Unlike conventional therapeutic plasma exchange, Inuspheresis does not require plasma replacement, for example, like albumin or donor plasma, which reduces the risk of volume shifts and electrolyte imbalances. Also, of course, there are possible allergic reactions or transfusion-associated infections. So it offers a somewhat selective, safer, and maybe more sustainable approach, well suited for integration into functional and regenerative medicine frameworks. And in Europe, it has been used for over 20,000 patients and about 70,000 treatments across 50 plus clinics. But as you have mentioned, it's not yet available in the US. Proxima Health is working to bring it here, and they plan to receive the FDA approval by 26-27.
Excellent. And can you walk us through the procedure, like where, with any type of apheresis, it's essentially typically a 2-needle system. You can do it with one, it's slower, but there's essentially blood is pulled out, it's run through the machine, and then there's something that is pulled out to waste and something that goes back into the body. But can you talk to us about what is the process with Inuspheresis for what happens in the magic mystery of that machine?
Yes, as you have mentioned, we normally have two lines in cubital veins. That's how it's normally done. In case somebody has really terrible status of veins, we do a central line. In that case, we only do one. We use then a central line normally in the groin, and it is like a double cath used for 3 to 5 year old children, so it doesn't have to ruin the groin completely. So it's a nice possibility. Anyways, you do have then one way out and one way in. And
Mhm.
from the way out into the machine, it first goes into the first filter, which separates the cells from the rest of the blood. And then the serum is run through the actual filter. Then it kind of joins together, runs through a warm-up system to warm it all up again, and then goes back the other way. That's basically how the system is run. As I have mentioned, I do have a session coming up then after our talk, and I'll be glad to do like a short video that you can include in your podcast later.
Fantastic. Perfect. And can you talk about, so that's so interesting, the two membranes. So the first membrane pulls out cells and then the second really pulls out the toxic elements. Is that right?
Right.
Okay, excellent. And can you talk a little bit about the history and the development of Inuspheresis?
Sure. Well, the system itself was developed in the early 2000s in Germany, in Kamm, under the leadership of Dr. Richard Straube, who is one of the biggest specialists in environmental medicine. And I talked to him. Actually, I did my first treatment also in his clinic. And the biological inspiration for the system kind of comes from the glomerular filtration process of the kidney. So that was like the idea behind it. But then technologically, it was influenced by Japanese advancements in sponge-like polymer materials, which were adopted then for these selective apheresis. And the filter contains a highly porous, chemically functionalized sponge-like absorber material with a large surface area. And the magic allows semi-selective absorption of pathogenic molecules, such as cytokines, heavy metals, environmental toxins, but it is permitting the essential proteins, the IgGs, the IgEs, and electrolytes to pass through, so you don't lose any of that. And the filtration columns attract and bind these low molecular weight and protein-bound toxic substances that are typically fat-soluble and that they're not usually efficiently eliminated by hepatic or renal pathways.
Got it. Got it. Got it. And so, can you talk about your background getting started with Inuspheresis? Like, how'd you get interested in this?
Well, late in my career, fairly late. As you have mentioned, I was the medical director of that large company that offered rehabilitation. And that company got sold, the top management was exchanged, and I suffered already the years during my medical director career there on central or chronic central serous chorioretinopathy for years
Mm.
without any improvement on conventional medical therapy. And my vision of the left eye dropped to only 10%. So I was almost blind on my left eye. And then I had some more time, and in 2020, so just before COVID, I mentioned my issue to a holistic medicine colleague I met by chance, and he did a pretty basic lab, but he did my high sensitive CRP for the first time. I've never done that test in my life. And it was 20 at the time, which is really high. And he heard about the clinic in Kamm and told me, well, try it out, see how it goes. And then I went to Kamm, I met Dr. Richard Straube, I talked to him about it. We performed 2 Inuspheresis treatments within 48 hours, and my high sensitive CRP went down to 0 after only these 2
Wow.
treatments. And I felt great. The vision improved. And the next checkup at the eye clinic, my chorioretinopathies resolved completely.
Wow.
It never came back.
You've
Wow,
been
that.
suffering?
Excuse me?
Sorry, how many years had you been suffering with this?
Since about 2000, and no, I know exactly because my youngest daughter was 2, so 5 years since 2015. So
Wow.
2015 to 2020, which was quite a long time. And unfortunately, my eye could not recover completely, so my eyesight never came back. But the serous chorioretinopathy went away completely, but it was just a little late.
Wow.
But anyways, it often comes on the other eye as well, and my other eye is spared. But no, I'm not doing just that anymore. I'm doing full functional medicine now that I've learned all about it. I treat myself completely on all levels. I do have a psychologist here in the office. I have a nutritionist in the office, so I care for my eye more than just by plasmapheresis. But that's how it all started, and I got everything down to 0.
Oh, that's amazing. That's an amazing amazing story. I mean, and it really speaks to the combination problem of inflammation plus tissue damage.
Right.
So when we pull back on we can pull back on the antibodies, but the real mission here is also to pull back on the tissue damage. So it's really a good reminder to treat early, to treat more aggressively early.
Early, treat aggressively, and it was a quick decision for me to start this business in Vienna, and I was the first one who opened up the Inuspheresis clinic in Austria. In the first 6 months, I performed several hundred treatments in the clinic, and the results with Inuspheresis alone were not as satisfactory as in my case. And that's what made me start. I started looking for the root cause for these often not so satisfactory results, and then I came across functional medicine and a system-oriented approach to the complex chronic illness. And in my opinion, IFM offered the best opportunity for education and certification and community. And the rest is in the history in the meantime. I have treated myself and over 2,500 patients with chronic autoimmune, neurodegenerative, and other chronic issues. We did almost 1,000 sessions of Inuspheresis in my clinic, and I use functional medicine approach in as many cases as possible, regardless if curative or preventive. And about 1/3 of the patients are coming from abroad, very many as far as from Australia.
Amazing. So what are the conditions? Talk about some of these conditions and kind of the categories that they fall under for either who seeks out Inuspheresis or who is most appropriate to receive it.
Well, there is this perfect storm. I call it perfect storm for Inuspheresis, and this is inflammation and toxic load with a combination, with some phase 2 detoxification issues that you might even know of, or you see according to the results and toxins. That's like a perfect storm. If you do Inuspheresis there, you will have a clinic result very quickly or immediately. But you don't get that you don't get it all the time. Inuspheresis is being used broadly in functional integrative clinics all around Europe, and we treat different chronic conditions that may be driven by environmental toxins, chronic inflammation, immune dysregulation, or post-infectious, of course, syndromes. And not all of those are the perfect storm. Then they will profit in the whole spectrum of therapies, but they will not profit by Inuspheresis alone. And if we take a look at these, of course, you will have long COVID patients, you will have a vaccine injury, chronic fatigue, Lyme disease, co-infections, Alzheimer's, of course, worked great. I had one case of Alzheimer's, I have to mention it. The guy, we had to bind him to our bed because he was completely disorientated by the first session, which was on a Monday. And on Wednesday, he came in with his own car, driving his own Tesla. So that's, also nice case. Not all of them are like that, but you are really happy when you get one of these.
I mean, it's good to know the range, you know what I mean? So that people have an accurate understanding, like a clear picture. Case studies are always the most that it actually happened. It's not an average of results. It's not what might happen or what might be typical. It's kind of like this happened as well as this happened. Maybe nothing happened, or maybe you have this incredible resolution. That's amazing. That's really amazing.
You just have to wait long enough. Even people that are not satisfied, they even call you and write, I've done the procedure, I paid a lot of money and nothing changed. And I got a lot of these that told me like 1 year later, but things did change. They do change. It just take time. They're just not so immediate. The response is just not so immediate. So like, in rheumatoid arthritis, all these autoimmune conditions are great because that's not just a question of environmental toxins. It is also a question of immune mediators and inflammatory markers, and all that is reduced by a great amount. So that's also, a very, very, very nice indication. So any centers that are dealing with that are just great. Also Crohn's, colitis, yes, of course, you have to keep them on their standard medication, but as an add-on, great. IBS, leaky gut, neurodermitis, psoriasis, polyarthritis, polyneuropathy is also a nice one because we know that in many cases it's not just the alcohol, it's not just the sugar, it's not just the glucose, it's sometimes also toxins. It is mycotoxicity, hepatitis C. Yes, also cardiovascular diseases with high LPA. There are other means now of getting that stuff out of your blood now, but is an alternative, yes. Also, which works great is infertility and IVF preparation. I mean, that's just fantastic. I've had cases that did not even come for me for that reason. All of a sudden, bang, the baby is there. So had nothing to do with it. So, the cases that are also just great is it's just general longevity and just, people that are healthy. I love doing those because they profit 100%, that you can guarantee.
Yeah, yeah.
So yeah, as I said, I always do the functional medicine approach. In addition, because you don't always get these perfect patients, and in a combination, then it works great. So I'll always check the center of the matrix, do the diagnostics with micro and macronutrients in full blood, vitamin D at least, the glucose metabolism, inflammation markers, permeability, ways, hormones, microbiome, mold digestion, viral and toxin load, and also genetics. And in practice, you wanted to know that as well. I start the therapy at the first visit. Just like you guys, the longer I am in this business, the less I need all the labs. You can make an educated guess. Start immediately, then do your labs, and then plan normally the plasmapheresis just after receiving the comprehensive lab reports, which is like a couple of weeks after the first visit. That's what we normally do.
So what kind of preparation do you do? So let's say, if a patient is coming to you, longevity is easy, as we talked about, because there's, you kind of can't go wrong. But if somebody is coming to you, let's say with Alzheimer's, Parkinson's, neuromuscular autoantibodies, myositis, where do you start, or how do you put it in?
The essential remedy is get his stress down and get his gut in place.
Okay. Okay.
So I use just, very classic. No, I know there's not much philosophy behind it. I just follow the functional medicine protocol, do the essential of the matrix, do the lifestyle, do the gut.
Got it. And when you're talking about the center of the matrix, for those who are not necessarily functional medicine savvy, who are listeners in the audience, the center of the matrix is really like the mind, the spirit.
The mind, the spirit, the emotions, the psychology behind it. I have my own little statistic where like my chronic autoimmune patients they were sexually abused in the early childhood to over 20%. And I'm sure there are more, and they never told me. But I asked that specific question already in my questionnaire. It's unbelievable. It's just 20%. That's so much. So you just can't leave that there, because you can do all you want if you don't at least approach that and they need a specialized help. I have a trauma therapist here, and they take care of that. So this emotional and psychologic and the mindfulness, that is so crucial in these chronic patients. That's why I employed these people here, because I just cannot, do my work without it.
That's amazing. So Vince Felitti with his original study ACEs, the original ACEs study, Adverse Childhood Events study in the mid-90s, that was his kind of accidental finding, was about how much sexual assault there was in childhood and how much that led to failures in his obesity clinic, that even people who were progressing and potentially losing weight, who had been referred to him for obesity, then 50% were still dropping out of the program despite being potentially successful. And one day he was talking to a patient, and I think there was something like he was tired, and instead of saying, at what age did you become, so there was a question like, instead of like, what age did you become sexually active, it was something like, what weight did you become sexually active? And the person said 40 pounds. And he said, wait, what? And that's when he realized, and in the mid-90s, it was a big fight for him to get this large study. I think it was like a 16,000 person study underway to kind of determine these adverse childhood events, and then the health conditions that can be associated in adulthood, which can be things as COPD and fractured bones and stroke. I mean, things that like you would never suspect chronic obstructive pulmonary disease to come from adverse childhood events, but there are these connections. There's ways that our nervous system does get set up, and it's tricky because we can't then say to somebody, oh, you can just meditate your way out of this, or if you treat your trauma, your will resolve. Mind, it is a body, mind, spirit all together. And so we have to treat the body, the mind, and the spirit. So it is wonderful to hear you say this.
Yes, no, Inuspheresis is not a magic pill. Sometimes it is. In my case, it was, but that I'm just one single case report. That's not how life really works. And you have to really, really take into account all these levels of the root cause of the disease that comes along.
Absolutely.
Because there's only one absolute contraindication, and this is the weight of the patient, which you've just mentioned, the 40 pounds. Our lower limit is around 90 pounds.
Got it.
45 kilograms is about 90 pounds roughly. And also the general condition. Patients in a really, really poor general condition, these severe cases of chronic fatigue, bedridden, full-time care. I would not treat those patients in an outpatient clinic. because rebalancing the toxic load is an energy consuming process. It's not just the osmotic pressure that pushes the toxins around, and this may cause worsening of the symptoms for weeks in these patients. Also, the patient which you might probably will see then later on in the video I will make for you. She also is a fatigue patient, and we did her treatment 7 days apart for the same reason. And she was sleeping until every day for 14 hours for 5 days. So I'm happy I recommended her not to do the treatment after 48 hours, which is like our majority of the patients. I gave her a 7-day rest. It was a good idea.
And so can you talk a little bit about that 48 hours? So how long is each treatment?
The treatment depends upon the weight of the patient. So, I'm a big guy, over 200 pounds. It takes me about 2.5 hours. A small girl, 100 pounds, will only take an hour and 20 minutes, maybe.
Okay. Okay.
And
And then why do them 48 hours apart? Why do the second one 48 hours later?
because Dr. Straub explained that to me because he has measured these shifts in toxins in the body, and they kind of flap back and forth, and you get after 48 hours you get more toxins in the serum than what it normally is in the serum. It kind of swaps more into the serum from the fat and bone tissue and from the brain than it is normally. So that's why he loves to do these 48 hours. And we do 48 hours in, I would say, 90% of the patients. But sometimes you make these decisions and they're good ones, like this week or last week. I had to do the treatment 7 days apart. It's individual again.
Got it.
And you do get some supportive. You get in these 2 hours. You get also weight dependent heparin between 5,000 and 10,000 units. And the patients do get a bit of IV between 500 and 750 milliliters with some vitamin C, glutathione, all the Bs, folic acid, and some homeopathic mitochondrial support. That's also a protocol that a German clinic started, and we took over because it works well. So there was no need to establish something new.
Got it. Got it. That's so interesting. I've never heard of IV homeopathic.
Yes, that's an Austrian company actually that produces that. I can give you more information on that if you like.
I would love it.
I
Thank you. And so they do this, between hour and a half, 2.5 hour treatment, and then 48 hours later, they come back for another session. Are there subsequent sessions? When would you choose to potentially do subsequent sessions?
Well, we do the testing sometimes. The cost for testing is around 800 euro per test. That's the one you would like to send in from the States. And it doesn't make a difference if you test the serum or the effluent. The costs are always the same. Depending upon and also these effluents have a certain look. If you don't get much out, it looks more or less like a clear urine. And when you really get a lot of toxicity out, because we have our experience, because we take a look at it macroscopically when the effluent is just there sitting in front of you, and then we know the testing. And I can also provide you some pictures if you like. I'll send you a few.
Sure.
Of the bad ones, I'll send you a few of the good ones. And then what is really great, if you, probably have never changed oil in your car, well, maybe. But you have cone at the very bottom of the heavy metals, and that's like so clear. It looks disgusting. It's like really a cone of heavy metals at the very bottom. And then you have a layer of different things, and the more inflamed, the more dark red, brown it is. That's where we have it special. And then also it gets, when you have microplastics and fat-bound toxins, it has a certain consistency. And when you squeeze it and it kind of flows around in a saline solution, you can kind of tell approximately what it is. There is no study on that, but I have thousands of sessions performed, and I have that, the effluent testing. And in the meantime, we all are capable of at least judging approximately the issue.
Got it. Got it. And then from the lab, so the lab you send serum before and then you send effluent after, is that right?
Yeah, serum before. You can do serum before, serum after. That I think is also very exciting. And you can do the effluent itself, or you can do all three.
Got it. And there's been some, in my experience over the last 15 years of functional medicine and doing testing like heavy metal testing and toxicity testing, there's been some indications that once you loosen everything up in the body, once you rattle the tree and things kind of fall. Sometimes after doing detox, you actually see more in serum because it's been pulled from deeper tissues. And so, the way that I was trained was dilution is the solution to the pollution, so that the body will essentially either add weight or fluid to kind of dilute what the body sees as toxicity, or it'll sequester it away, like in bones or adipose in these storage cells, these storage structures, as opposed to having it loose in serum. And so when we're looking at plasmapheresis effluent or serum, testing blood, the compartment that we're testing is the liquid blood compartment versus bones, central nervous system, adipose. And so I'm curious your thoughts about how toxicity moves in the body in terms of the results that we get with testing. Does that make sense?
Yes, absolutely. And I absolutely agree with you in everything you have said.
Okay.
Not really test, and we can never really know what the hell is going on exactly. So we don't have our clinical picture, and according to the clinical picture, we make an educated guess. If somebody is having a perfect diet, fixed gut, low on calories, a little bit ketogenic diet, doing sports, and not being able to lose weight, then you kind of have an educated guess you have a toxicity problem. And yes, even Dr. Straube sent you that also these slides. If you take a look at them, there are certain heavy metals which are always higher after the treatment. So that's exactly that issue with the toxins changing the compartments and going from one to the other. And as you said, shaking the tree, you get even more afterwards. My wife is a fairly healthy person, and in her first Inuspheresis looked really completely clear, like urine, and then the second one looked terrible. And that's exactly it. We kind of shook it up. She's a Hashimoto patient, quite good. She's a cardiologist. She's not doing bad. She's full-time working and doing cath lab. But yes, we got quite a bit out of it for her the second time. So yes, you can see that as well. So basically, it's really the clinical picture and the patient that gives us the indication and not the labs. The labs are there just to support it. Maybe some patients that are not sure, they need a push into the therapy, then you like to do it. I have patients that have done 10, 20 therapies, and then after the 11th or 12th or 14th, you really get more and more clear effluence. Then I like to then do the test and tell them, okay, maybe it's time for you to just do detox further orally. You don't have to do the treatment all the time anymore. It doesn't really make sense. So I do that as well.
And so if people are doing that many treatments, are they doing them a week apart or a month apart or 2 sessions once a month, or what?
We start with 2 sessions. So we try to start 2 sessions within 48 hours for the reason we talked about. So that's like the goal. If the patient is too weak, we do it after 7 days. And then we do a third session after 3 months. That's like the 3 months. So it's, 48 hours, 7 days. And then after 3 months or after 6 months, it very much also depends about how financially the patients are strong. That's very often bottom line the decision how we make the further treatments. But if money is not an issue after 3 months, after 6 months, and then depending how they feel and how the whole therapy is running, we make the decision how to proceed from there.
Got it. And so what do you see coming out in the effluent? What do you like when we've talked about the testing, but what is the testing? What is being tested for?
It is we test for a whole lot of heavy metals, solvents, pesticides, herbicides, and we could. So let's just focus on a few because we test like aluminum, which is not really heavy metal, but we test for that, and plus the heavy metals. But what really is most common, we find a great decrease in inflammatory markers in the effluent with time, like high sensitive CRP, ECP, RANTES, then rheologic markers like fibrinogen, LPA, PLA2, markers for oxidative stress, then pesticides like DDE and DDT. I mean, that DDEs in Europe very high always. Then solvents like ethylbenzene, xylen, toluene, and as I've also said before, you have this reduction in heavy metals varies from metal to metal. It is semi-selective. Like nickel and antimony go down by 80%.
Oh, wow.
They work unbelievably. Barium, aluminum, magnesium are also great. They go down by 50% before and after in serum. Okay, we know that the compartments may look different, but at least you get 50% of the serum, you get 80% of the serum, which is a lot. Mercury and copper are not that great. You get about 15% reduction in mercury and copper. So sometimes in patients with high mercury load, I like to do DMPS or DMPA IVs. I sometimes even do it during the plasmapheresis just to get more out at the same time and not to go hard on the kidneys. And then Parkinson's related antibodies like beta 1, 2-RAA, that also went down by like 50% on average in serum. That's where you can kind of say the most. The microplastics are also out very nicely, but it's difficult to test because they disintegrate very, very quickly, and you would really need to have a lab in the clinic to measure the microplastics. That's unfortunately not so easy.
Got it. That's interesting that because microplastics I think of as, I know they're not technically a forever chemical, but I think of them as not degrading very quickly. So that's interesting that they disappear.
That we have trouble measuring that. We, you know, the what some of them like the breast implants you can measure because they have a certain plastic which stays there for a longer period of time. The typical microplastic somehow when it's not in the body it somehow disintegrates. Anyways, the lab in Switzerland told me that it is just impossible to measure because it disintegrates in a way that it cannot measure it. I'm not a lab technician, so I would not go more into the details because you
Yeah.
simply don't know the details.
Well, it's interesting. We forget that plastics are very similar to lipid structures in the body. So, without knowing, conjecturing, on a podcast, you can say anything. So, conjecturing, I just wonder if they kind of disappear from a device that tests because perhaps they look similar to other lipids in the system so that they appear invisible even though they are still present, but you can't separate them to identify them.
That sounds good to me, but I wouldn't know.
Perfect. Well, we'll leave that there.
We'll ask somebody that does.
Yes, exactly, exactly. And so do you know what about gadolinium? Because there's such a
That goes up nicely as well. We test for that as well.
oh, great, and that comes down.
I would say gadolinium goes down by 50% roughly, between a third and 50%. You have to look it up. You have the slide, but I would have to look it up. But it goes out nicely. The
That's
only
great.
troubling one is mercury, really.
Okay. Well, it's interesting. So, one thing we haven't talked about, my background in Ayurvedic medicine. So, Ayurveda has been doing detox for 10,000 years. And the preparation for the detox, you can't detox. You're not supposed to do a detox or elimination until you've done proper preparation. And the preparation is incredibly lipophilic, which I think is very fascinating from the Ayurvedic perspective. So, you start with simplifying the diet so that the digestive fire can really burn the trash that's there. And then you take ghee internally or some other sort of lipid like coconut oil or sesame oil, but really it's not sesame oil as much internally. But I mean, you do obviously we not in the quantities that are used for detox, but coconut oil or ghee, really ghee is the primary. And then you do external oleation with oil massage, with oil in the nose called nasya, oil in the ears, oil on the forehead and along the scalp, oil all over the skin, oil packs with different herbs over the liver. And then you end up, the idea is that you're actually pulling with all this oil, with all these oils, you're actually pulling toxins back into the GI tract, moving compartments for elimination. And then you do the elimination with either drinking castor oil, small amounts of castor oil, which should never be done without physician oversight or clinician oversight, and or sesame oil, herbal medicated enemas, or in India, traditionally, they will do what's called vamana, which is therapeutic vomiting, depending on the patient constitution. Your constitution would actually be appropriate for therapeutic vomiting. That kapha.
Because I have one of my employed doctors that moved back to the States. He is from the States. He was in Austria for a while. Now he moved back to the States. He was a Ayurvedic medicine specialist. He told me that, so I know.
That's great. Yes, yes.
He
And
gave
then
me my lesson on that.
yes, yes. And then there's also what's called Rakta Moksha, which is technically translated as blood liberation. And so that is the Ayurvedic equivalent, or that is, what Inuspheresis is. That's what plasmapheresis is. I mean, I guess it's Moksha. You're liberating plasma as opposed to necessarily blood. But those compartments are also, it's the same compartment where the blood and the plasma are together. So and it's unclear from my knowledge of the Ayurvedic literature if when we talk about Rakta as blood, if this is the red blood cells or this is all the other factors that are in that vascular compartment. So, all that to say that 10,000 years ago, this type of removal of factors in the vascular compartment was part of the detox mechanism. It was part of the recommendations. And it will be interesting to see over the next couple of years. I would love to develop research around this. If we started with this lipophilic preparation phase, kind of where we would get with Inuspheresis, with plasmapheresis. So who knows?
I think it's a wonderful idea. I can even get you in touch with my colleague that's moving back to California. He will be there, I think he's flying on the 26th of June. I remember that. So he will be there in July, and I'm sure he has a lot of experience because you have to be there medically when the procedure is done, and I've employed him for that. And what I have learned from him is exactly that question: how much can we detox? Who is suitable? Who is not? Because he looked at his patients from your perspective, which was great. We never used oil treatments because I guess he just didn't want to bother me with that. But he also was telling me, I kind of prefer the treatments in summer, in the warm time, when it's cold and, the energy is down. It's not such an ideal time to do it. So this individual type, and you have a certain name in Ayurvedic medicine for that, which I'm not going into because I don't know. But we kind of use that to make the decision: 48 hours, 7 days, not at all, later on, prepare the patient. We've used that.
Yes, exactly. So the constitutional types, if people are primarily Vata, Pitta, Kapha, if how they're going to metabolize. Yes, and so we do that in our clinic to some degree as well, depending on the individual patient and kind of what they're there for. We just had an MS patient in last week, female, 37, something like that. Last year was diagnosed. She's a pharmacist, so no, not woo woo, not no, no trauma. But she has these ongoing symptoms, and she just finished our 5 days of Ayurvedic Panchakarma, so she did the full preparation, she did the full 5 days of oil treatments, and then she did the full elimination. And in that time, I now saw her first month of follow-up. Her MS hug, that squeezing of the thorax that happens in MS, gone. Her numbness and tingling down her left leg, gone. Her foot drop, gone. Her bladder symptoms, gone. So she has small flares of them with stress and travel, but for the most part, there was nothing else that had helped over the last year that she's been symptomatic until this procedure. And she's like, she says, I went in with an open mind. I didn't always love the treatments, but I'm shocked at the outcome. And she's considering doing it again in October. So 6-month follow-up, do another round.
No, congratulations. I'm sure that works. We have great improvements in all these patients. And of course, the elimination diet, like almost everybody goes into an elimination diet. In these 3 weeks after the first visit and before the treatment, it's almost like a regular protocol, just because of the gut and leaky gut and whatever is the background. So we kind of end up doing very similar protocols.
Yes.
From a different perspective.
Yes. Yeah. So I'm curious a little bit about, as we're talking about how we're going to progress the science, I'm kind of curious about the research into, where the research has been with Inuspheresis, where you see it going now, and kind of what you'd like to see moving forward.
Well, as in other fields of functional medicine, high-grade evidence is lacking due to the complexity of chronic diseases and just the multiple interventions we need to do to improve the systems. We have the same issue in plasmapheresis as well. But there is some evidence, or there is growing evidence in supporting apheresis in neurodegeneration, particularly Alzheimer's. There are studies around that area where apheresis has been shown to reduce the inflammatory mediators, fibrinogen, neurotoxic proteins. And, some studies are suggesting certain improvements in cognitive function, even in the disease trajectory. The same thing is also in autoimmunity as such, where we also see the reduction of immune complexes, antibodies, and rheumatoid arthritis, lupus. There are smaller case studies. There is evidence. Let's not call it a study. Let's call it evidence. That's kind of a better word for it. Also, metabolic dysfunction, what you've been talking as well about, that's something which is driven by oxidative stress and especially toxic load. And also there, you see data. You have data basically. And what I like most is the data that Dr. Strauber gathered on his 1,500 patients, where where he found all these significant decreases. I have already mentioned. I don't want to repeat myself. Also the heavy metals. So that's the nicest data I got. And what I did on my first 20 patients when I started the plasmapheresis in Vienna, I did measurements in plasma before and after, and my data match the data on 1,500 patients really one-to-one. So for me, this was enough data to morally and ethically start with a treatment. And the names to look out for in Europe are Dr. Bornstein from the Dresden clinic. He has a couple of devices where he's what he's using in the clinic. It's always a clinical setting is always better for studies because it's not biased. We always get the problem of we get biased, and or Dr. Straube developed the filter himself. Then of course it's also not so great for publishing because he's trying to push his own product. But Bornstein does quite a good job, and there's also a trial in Spain which is coming out with this is a regular therapeutic plasma exchange, also in Alzheimer's. So there is data and studies coming out, but the basic problem stays like in all functional medicine, and that is the complexity of the problem and the treatment, not just with one drug, but rather with its whole approach.
A whole pantheon of treatments. Great. Great. Really exciting. Well, what else should we talk about? Is there more? Have we covered things?
Is there more? We have covered a lot. I've shared my clinical experience. What we can do, I can walk you through the room if you like during the podcast, or I can send you the video afterwards, whatever you prefer.
Let's walk through the room now, if that works, to take a look at the machine. And then when the patient is there, you can send that video after.
All right. Yeah. Okay. Let's clear that. I'll clear my background. So you see all clear. So this is my office with a view over all of Vienna.
Beautiful.
So we're on the top floor, and now we're moving to the next room where we will probably, there's the machine loaded. So the machine, there you go. This is the loaded machine.
Got it.
And this is the bed, and you can see the monitor in the back. Now you can't see the monitor because the monitor is right here, so the patient is monitorized.
Uh-huh.
Treatment. All right, and so I can walk you through the office so you see the crew. Maybe that's always interesting. See where they all are.
It is. This is good.
Tina, can you see her?
Hello.
Yeah, I got her right. And it's her birthday today too.
Oh, happy
She
birthday.
started working, which is great. And Nicholas is also a great part of the team. He started off as a patient, like in some of your cases in the States as well, as I've heard, and now he's a part of the team. And and then the rest of our practice, I do offer other treatments, IVs, and also hyper and hypoxygenic therapy. That's also something cool, which we can talk about at one point. I love doing that. And now it's time to, the patient right now is in the back. We'll leave her alone. I don't want to push her, but she's on a special magnetic field therapy, which combines music, vibration, and magnetic field. That opens up the blood-brain barrier.
Yes.
Kind of opens up also these compartments like you do with Ayurvedic medicine. So I try to have an approach rather through the Chinese medicine.
Yep.
And but also with the same goal. And we do that every time before the treatment. And what we have realized right away is that we have far less spastic veins, because the veins also have a soul, and well, they don't have a soul, but they have a muscle layer in the blood vessel, and that tends to contract when they get anxious, which is quite normal when they get a thick needle in their arms. So we put them on that treatment before they actually start. That's something which we have not talked about, but that is something I'm the only one who does it that I know.
Fantastic. That's a fantastic way to go about it. I've always called them like a vibe table.
Yep.
It can be remarkable. It can be remarkable. Excellent. Fantastic. Good. Well, thank you. This has been an amazing show. This has been an amazing understanding. And thank you for joining us, and thank you for sharing with us all about Inuspheresis. We are hoping, we're doing this recording in May of 2025. And the hope is that by 2026 or hopefully sometime in 2026, we'll have availability for double membrane filtration Inuspheresis in the United States.
Thank you so much for the invitation. I'm looking forward to meet you in person soon in San Diego.
Yep, next week.
It would be my pleasure to be on your podcast anytime again when we have something interesting to talk about.
Thank you. I really appreciate that. Thank you.
Thank you so much,
Really,
Rika.
really fun. Thank you. Thank you. And we love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together and are committed to sharing knowledge and insight that empower us and our communities towards greater health. Thank you for listening to the Nervata podcast for complex health, and we'll see you next time.
Bye.